What's up, everyone? Welcome back to another video. If you are new to the channel, please go ahead and hit that subscribe button and a notification bell so you'll be notified when I do post a new video. In today's video, I'm going to be giving you guys tips on how to properly call the doctor. So yeah, let's go ahead and get started. And like I said in the last video, if you haven't watched that video, please go ahead and head over and watch it. You know, it's just a few tips on, you know, what you should do if you're new at a facility as a travel nurse or an agency nurse. So like I said, if you haven't already watched it, please go ahead and watch it. And in that video, I also stated that in some videos, I'll have on the same clothes because I'm recording more than one video in one day so that I can have more content for you guys. So without further ado, let's go ahead and get into this video because I do not want to waste you guys' time. I know how y'all like to click on the video and get into what the topic is. So we're going to go ahead. So how to properly call a doctor. So first thing first, sometimes when you call the doctor at nursing facilities, if it's after hours, the weekend, or whatever the case may be, you won't directly get the doctor. Sometimes you have to call into their little calling service and leave a little note. So if you happen to have to do that, when you leave the note, you're going to have to leave the resident's name, their room number, date of birth, and what is, you know, the diagnosis, what symptoms are they having, what's the problem. And then most of the times the doctor will give you a call back within, this is kind of iffy depending on the doctor, but between 5 to 20, 20 minutes. Just like I said, depending on the doctor. So if you happen to do that, just stay by the phone. Make sure you are listening out so you won't miss that call, because once they call back, you don't want to keep them waiting. You don't want to keep the resident waiting any longer. So make sure you are paying attention to the phone and not too far away from the nursing station so you can hear it. Or if someone is by the nursing station, let them know that you're expecting a call back from the doctor. Now, if you don't have to do that and you are calling them directly, make sure you have all your ducks in a row. You're going to want to know all the information that you need, because doctors do get impatient and they will hang up on you and tell you to call back when you have your stuff together. That has happened to some people I have been around, and I was like, okay, I don't want to be that nurse, so I always make sure I have everything I need before I call. So I'm going to give you guys, I don't know why my voice so cracky. So I'm going to give you guys the things that I would have jotted down. So first thing first, of course, you're going to have their name, their date of birth, room number, and I would want to have their diagnosis. Whatever they was admitted into the nursing home with, I would want to have that jotted down. And if they're, especially if they're new, just coming over from the hospital, you're going to want to know why they were in the hospital, you know, what they did at the hospital, and why are they being sent to the nursing home. So have all of that down, because it might be the doctor's first time hearing about this patient, because most of the times they send their nurse practitioner in before they come in, and then the nurse practitioner do the evaluation and stuff, and then they'll let the doctor know little snippets about the resident. So you have to really paint that picture about that resident. So have the diagnosis available and a little bit extra information on why they were sent to the nursing home from the hospital. You also gonna want to know the symptoms. Why are you calling the doctor? What is going on? Are they vomiting up blood? Are they having severe cramps in the stomach, in the leg? Did they fall? Why are you calling the doctor? You're going to want to know all of those details. If they did fall, you're going to want to know the time. When did it happen? What have you done so far? when it happened, where did it happen, what do they look like since it happened, do it look like something's broke, do they have bruises, do they have a hematoma. You're going to want to know all of that stuff, and you're going to want to have all of that stuff jotted down. All right, sorry for the interruption again. Kids don't want to listen. But like I was saying, with the symptoms, you're gonna want to know. You're gonna want to, like I said, paint the picture for the doctor, as if he's standing there looking at the resident. Next, you're gonna want to know the vital signs. Make sure you have the vital signs jotted down, from the blood pressure, respiration, pulse, oxygen, everything. Put everything down. Heart rate. Have all the vital signs available. And do a full head-to-toe assessment on the resident. And if it's something that you're trying to, point out, make sure you have, like if you, let's just say you're working with the GI system. Make sure you have done everything. You've listened, you've touched and felt around, asked if they were in pain. Do all of that. Make sure you cross all of your T's, dot all your I's. And also labs. If they had any labs recently, make sure you have that available. Let them know the past values and the recent values. If they have, more than one set, make sure you let them know. So if anything was lower then and it is higher now, then they'll know what to do. Or if anything was higher then and it's way lower now, and then they can kind of give you more, let you know if they need to order more labs, or if they need to send them out to the hospital, or if they need to order a certain type of medication. So you really have to, like I said, paint that picture so they can know how to move forward, because the doctor might be in the Bahamas or in bed or out eating. You have to paint that picture so they can be like, okay, this is what we need to do until such and such. So paint that picture. Also, let them know what you've already done. If you've already given them some medication, let them know. Whatever the case may be, whatever you've done before you've got a chance to contact the doctor to, give the resident some relief, let them know, so you won't be running in circles. You won't be repeating something that you've already done. You just want to make sure you let them know, so we can go ahead and be progressive and not, just wasting time. And then another thing, I always let the doctor know what I suggest as a nurse, because I'm the one there sitting there taking care of the resident. I know what's been going on hands-on. So I always try to suggest what I think. It's just a suggestion. It's not telling him what to do. It's just, a suggestion. And if you know how to talk well and communicate well, it's not going to be like you're trying to tell the doctor what to do. Most doctors like to listen. Some don't care. But you will know the energy, whether you should suggest something or not. But most of the time, if they're a good doctor, they'll listen to your suggestions and maybe follow them. Or they'll just say, okay, whatever you think is best. But make sure you get the doctor to say, okay, yes, this is what, this is what I want done. When you call, make sure you have the chart available, and because it's some stuff that you might miss out, you might not write down, you might forget to write down. You'll have the chart right there, so you can just take a look at it and be like, hold on, let me go ahead and get this real quick. And I will also be in front of a computer. I will have the resident's profile pulled up. It's kind of easy to navigate through the computer better than it is to chart. So if you want to know like their diet or a type of medication that they're on, you can go ahead and pull that up really quickly on the computer versus, trying to look through the chart. So, but just have both of them available. So, you can have you want to be prepared. You don't want to seem like you don't know what you're doing, because some doctors will call you out on that and it just kind of do something to your spirit. So, just make sure you have all your ducks in a row. And make sure you have a pen and paper ready so you can take new orders down. When you're taking those new orders down, make sure you ask when he want it done, how he want it done, if you want it to be stat, if it can wait till tomorrow. Get all the information from the doctor. Make sure you put down the time that you called him. Make a note in the computer, stating everything that he said, when he called you back. Like, make sure you put everything down in your notes. I would do note on my paper, and I will also go and do the note in the computer. So that way you can cover your back, and you know, because like I said, have your ducks in a row and cover yourself as a nurse. But always make sure you do a note after you call the doctor. And like I said, when you get in those new orders, make sure you ask all the questions that you need to ask. When, like I said, when he want it done, how he want it done, who he want to do it, and just everything. When it comes to the medication, make sure you know, he tell you if you want it orally, if you want to do an injection, like all that good stuff. Just make sure you have it down. It's really not hard. A lot of people have anxiety behind calling the doctor, but I mean, they're just another person. They just have another title. But just always remember you're there for the resident. So just do what you have to do. Don't be so nervous about it. Just make sure if you have everything that you need before you call the doctor, to, you know, give yourself some confidence and know, yeah, I'm a good nurse. I got what I need. If he asks a question, I know how to go get the answer for him. Don't be all jittery and anxious about it, because, I mean, come on. In reality, you might be better than the doctor. I'm just saying. But, yeah, don't be nervous about it. It's just a phone call. As long as you have everything you need, you'll do fine. Be in front of the computer so you can have, you know, more information in case you forgot to jot something down. And just take a breath and keep going. Don't be so nervous about having to call the doctor. Now, leave some questions in the comment section if you guys want to know more about how to call a doctor. But this is basically everything that I can think of. I'm not perfect, but this is everything that I can think of that I would do. But if you have any more questions, please feel free to put it in the comment section. I will get back to those comments. And I'm going to end the video on that note, because I don't have anything else to add. And I'm pretty sure when I end it, something else is going to pop up in my head. But for right now, that's all I have. And I have a lot of more videos to make. I have a lot of stuff jotted down because you guys did leave comments on the post when I was trying to do my calendar. I forgot for what month, because it's been a minute since I posted a video. But I did jot all of that stuff down, and I have been taking notes. It was just taking a lot out of me to just get here and do the videos. And now that I'm doing it, I feel so much better. Because I really do miss doing videos. I have to really push myself to go live next. And, well, I can't say a lot, but some people did comment and say, do what's in my bag on live. So I'm probably going to do that as my live video. But we will see. I don't know what date I'm going to do the live video, but it'll be somewhere in the near future. But yeah, that's it on this video, how to call a doctor. I hope the tips were helpful. And I just want to leave you guys with, don't be nervous. And yeah, because we all are human. And what they going to do, beat you up? No, because you got to have all your information that you need before you call them. And if you need some extra, you're going to have a chart and you're going to be in front of the computer. So if you like this video, please go ahead and give it a big thumbs up. Leave some comments. Subscribe to the channel if you haven't already subscribed. And hit the notification bell so you'll be notified when I drop a new video. Okay? Okay. So, see you guys in the next video. I might be wearing this too because I'm on a roll. Okay. Deuces.